it's right at 12 o'clock, so we will get started today. Today is May 20th. We'll be recording this program, so if you're watching it in a later recording, some of the guidelines and recommendations may have changed, so be sure to check for those updates. Today, Rebecca's actually not going to be here, so I'm going to be covering the beginning and ending part, and then we have Laura, Roxanne, and Blanca are helping with the chat. So if you have any questions, please be sure to put them in there or just take yourself off mute and jump right in. Today, Dr. Lewis is going to be going over some of the adolescent recommendations, but just a couple of quick updates first. If you want to skip to the next slide, just a reminder of where we are. We still continue to have people who are dying from COVID-19. Our case counts are still going up, although much slower now because our vaccine numbers are going up. So the more people we get vaccinated, the fewer cases that we see that are spreading in the community. So we are on the good side of the numbers now, I think. So if you want to go to the next slide. New this week, just a couple of things to think about and to remember. Right now, you can order Moderna, J&J, and Pfizer from ASIIS. That's new as of this week. When you do order those doses, you'll be selecting whether or not they are the adult or pediatric presentation. There's not any difference in the vaccine, but the ancillary kit and the supplies that come with it are a little bit different. So this is a list of what comes in, the adult versus the pediatric kit. Looks like it's just a change in the needle size, the number of the larger needles. If you're seeing adult patients, you get a few more of those than with pediatric. Next slide. So other things new this week, no missed opportunities. This is a great report from the CDC. They have said that vials may be open without using every dose, and just do your best to avoid wastage. But if you have that patient in front of you that you know is not going to come back, you're going to want to get them vaccinated today, even if you have to puncture a new vial and that you may not be able to use. So we have now switched to the fact that we've got enough vaccine circulating in the community that we really want to make sure that we get every patient when you can. So if you've got someone in front of you that's willing to get the vaccine, go ahead and give it to them. Moderna this week is also going to start shipping those 14-dose vials. Just a note on this, the labels are very, very similar. So you're going to be ordering an ASIIS, whether it's a 10-dose vial or a 14-dose vial. Pay attention to those labels for your inventory. You may have to mark it some way with stickers to say these are 10 and these are 14, because you can see the only difference is a tiny little blue shading on the package vial there that's going to tell you the difference between the two. So that's going to get a little bit confusing, something to pay attention to this week as you get those new presentations. Next slide. Other things going on this week, Pfizer can be given down to age 12. Of course, we kind of announced that last week. Dr. Lewis is going to talk about it more. But those Pfizer doses come in huge packages of over 1,000 doses that have to be used pretty quickly. So one of the things that ADHS mentioned this week is that you can begin to share those Pfizer orders between offices. So if you have other locations or if you have offices that are near you that you know would like to give COVID-19 vaccine, you can begin to work with them to transfer some of those doses. But you have to have that approved through ADHS and in ASIIS before you move them. So reach out to them if that's something that you think that you might be interested in those Pfizer doses going down to age 12. Next slide. Reminders. One of the things that we've noticed is that a lot of the contacts that we have that are in ASIIS and in the COVID-19 onboarding system are either not active, or we actually heard from some practices the other week that said they were surprised when they got the 100 doses of Moderna. It just showed up out of nowhere. They didn't know they were getting it. They didn't really have time to plan. One of the reasons we think is because those the contact lists and the contact emails aren't up to date. So if you can just check that, make sure that you've got all your team on and your backup coordinators in there as well, because they've been sending out notices when they're going to ship them. But if we don't have the right contact information on there, it's probably being lost in your office. And then all of a sudden, surprise, you get vaccine you didn't know you were going to get. So I know that that was pretty tough for some of you all. The other thing is that you can, of course, we just talked about that, transfer doses to another clinic. Just work with ADHS to make that happen. Vials not completely used or expired, be sure to fill out a wasted doses report through ADHS so that they can account for that. They have said that at this time, the CDC is not going to hold anyone accountable for those doses that have been wasted because we don't want to miss any opportunities. Just a quick to point out the daily vaccine management task, temp monitoring 2 times a day, data loggers, download 2 times a month, count all of the doses in your fridge and refrigerator and compare those to ASIIS, and then report doses given to ASIIS and the total doses to vaccines.gov. Next slide. This is just kind of a how-to guide. We're going to post that up on the webpage this week. It's got all the links for those daily tasks that you have to do to report to ADHS and also to CDC, and links to all of those. So that'll be up today. And then I think our last thing before Dr. Lewis is we're going to do a quick poll. We're going to launch that here in a second on just to get an idea, what are the 3 most common reasons that you're hearing right now from people that are hesitant to get the vaccine? So this is multiple choice. You can choose up to 3 of those, but if you can take a few minutes to kind of look through those choices, we really are trying to get an idea of what people are concerned about right now. It looks like those answers are slowing down, so we can pull up the results and see how it looks. Concerned about side effects. It's a way for the government to control me. It looks like are the top ones. It's going to be, interesting how we take on these. Vaccines were developed too fast. That one is still kind of floating out there. So, thank you. We really just kind of wanted to get an idea of what was happening in the community and what you guys are hearing, so we can start to address those. But with that, hopefully, I think Dr. Lewis is going to tackle a couple of those here and there. Certainly the side effects as we move into the adolescent vaccines. Dr. Lewis is the medical director for ADHS, and she is our reigning expert on all things vaccines. So Dr. Lewis, I'm going to turn it over to you now.
Okay, good afternoon. It's good to be with you. Wanted to focus in on Pfizer because of the new approval. Next. At the CDC Advisory Committee on Immunization Practices, most recent meeting, ASIP, they discussed why it's so important for adolescents to get vaccinated, even though proportionally they have fewer side effects than the elderly, but they are still getting sick, hospitalized. And if you compare their hospitalization now with COVID, with the pandemic with H1N1, they're getting hospitalized more. And there's that rare clinical presentation, multisystem inflammatory syndrome in children. It's more severe in adolescents than in the younger children. And so vaccination will protect them from that aspect. I mean, the MIS-C shows up about 2 to 4 weeks after a COVID infection, excessive immune response to the COVID infection. Next slide. Also, we need to stop the spread of COVID. And the more people that are immunized, including adolescents who get around, interact with a lot of people, the less COVID there will be. And the next slide will show that there's an increasing percentage of COVID cases. And so you see early on in vaccination, I'm just looking here, early on in March of 2020, it was, the elderly that were really getting COVID. And so they're getting to be a smaller percentage of the cases, now just down to 8%. Whereas adolescents, the very dark blue are children 11 and under, and then the turquoise are the 11 to 17. And both of those are increasing to about 9% of the cases now. Next slide. This is showing how the influenza pandemic of 2009, the adolescents getting immunized, the adolescents getting hospitalized versus the yellow showing the COVID pandemic. More adolescents getting hospitalized than our previous pandemic. Next slide. Okay, this shows that from those 20 and under where the deaths are, and fortunately children don't tend to die from in the same rate that the elderly do, but there still are reported deaths, and the dark blue are the adolescents. And so far there have been 127 COVID deaths in adolescents. And you'll say, oh, that's relatively small in comparison with all the other deaths in older people. But if you take the top 10 causes of death in adolescents in 2019, this numerically would be among the top 10 causes of death. So it's important to get teenagers immunized. Next slide. So how does safety compare with the younger age group? And so this shows top to bottom, dose 1, dose 2. Then it shows redness, swelling, and pain. And so you can see a lot more pain at the vaccination site with the vaccine. But then it breaks the green is mild and the turquoise is moderate, but it also has two different, kind of 4 different columns. 2 are in the 12 to 12 to 16-year-olds. And then the other 2 columns are in the 16 to 26-year-olds. And then it compares the vaccine versus placebo. So of course you get more pain with the vaccine, but it's about the same in terms of safety between the adolescents and the young adults. Next. This also shows systemic reactions after the vaccine in the blue and the placebo down below, and this is dose 1, not a lot of fever, fatigue, headache, chills, muscle pain, that happens. And in dose number 2, next slide. Again, you see a little more fatigue and headache, and again, some chills and muscle pain. But if you compare, now they're the 2 columns together between the 2 age groups, there really isn't a lot of difference except in the muscle pain with the second dose, the older group is maybe about 8% more likely to get muscle pain. Next slide. In the younger age groups, they have higher antibody levels. Nice. And after the second dose of Pfizer in adolescents, after 7 days, no cases of COVID, so very effective. Next slide. This just shows the intention to get vaccinated. So here we are saying, vaccinate the adolescents. Well, will they want to? On the left are the adolescent desires, on the right are the parents. So the parents are a little more interested than the adolescents, but it's really fairly similar. Dark blue, absolutely. Turquoise, probably. Gray, not sure. Yellow, probably not. Orange, absolutely not. So we're going to have about 15% that absolutely do not want this vaccine, and another 10, 12% that are going, probably not. So hopefully more people will want the vaccine that are sitting on the fence right now, but at least we can get the 50 to 60% that really want the vaccine. Next slide. The new co-administration guidance, it used to be that it was, you needed to wait 14 days between a vaccine and COVID, and, another vaccine and COVID vaccine, or vice versa. In ASIIS, they were just announced in May 5th, it was just announced that they were going to revise the interim clinical considerations for COVID vaccine use, and you can give them at the same time, because it's going to be so important to catch up on vaccines. And there was just, they've got the experience with seeing what the side effects look like with the Pfizer vaccine. And that link, I'm going to be repeating it a couple of times during the presentation, and also the title, Interim Clinical Considerations. That's a document that gets updated all the time with new information on vaccine-related things, not administration aspects in really tiny detail, but for if you've got clinical questions, that's the place to go. But anyway, next slide. Pfizer, 12 and above, again, same dose, same interval, same contraindications. Actually, there's going to be a little change in the contraindication that I'll bring up. But for state vaccine sites, there needs to be a parent or legal guardian present to sign the consent form. Possibly at other sites, it may be a little different, but at the state sites, yes, it needs the legal guardian there. Next slide. These are the data that influence CDC to say we've got to go ahead and not have an interval between COVID vaccine and other vaccines, because childhood vaccines are down, MMR is down 20%. Some of the other childhood vaccines are catching up. Adolescents really are staying markedly down, 15 to 19% down. And that's pretty, these adolescents at risk for unnecessary cancer, unnecessary severe disease. And so you can give COVID at the same time that you give other vaccines. Next slide. One of the things you may want to consider, though, is that if you have a real reactogenic vaccine like pneumococcal, the pneumococcal Pneumovax 23, yeah, you may not want to on the same day, but in general, you can just co-administer. Contraindications of Pfizer stay the same, except at one point they had said that polysorbate, that is chemically similar to the polyethylene glycol that's in the mRNA vaccines, They had listed that as a contraindication. It's no longer a contraindication. It's just been moved to a precaution. You have polysorbate in the Johnson & Johnson, but you don't have the PEG, the polyethylene glycol. But anyway, tiny little details, and this won't apply to most people, but it can. Again, that interim clinical consideration for COVID vaccines has all of these important tiny details. And so if you can get up to date on them, you'll feel even more comfortable about making decisions about vaccines. Next slide. I had mentioned, I believe, the multisystem inflammatory syndrome in children, and also it occurs sometimes in adults. It's interesting that you have higher antibody levels after you have the MIS-C, the MIS-A. And so, but you know, those antibodies protect against reinfection. So since it's not known, they don't want to immunize too soon, but they don't want to leave people susceptible to infection. They say wait at least 90 days from the MIS-C and be recovered from the illness. Next slide. What is our summer COVID cases going to look like? This is one projection that just was printed in Morbidity Mortality Weekly Report from the CDC. And the gray line from April on is a confidence interval. But the dark black line is if people really aren't getting vaccinated and they're just not using the non-pharmaceutical interventions, in other words, social distancing and masks. We'll get many more cases than if, you know, the lowest line where there's high vaccination rate and moderate mask use, social distancing. Next slide. Okay, one of the questions we get a lot is when are we going to get to herd immunity? That's hard to say because this is a new disease. We have to see whether it's going to be 95% like with measles or whether 70 to 80% where you can really slow down the spread. The higher the better. It depends on how many people have immunity. So if you've gotten infected, that's going to help. But the question is, how long does protection from infection stay around? So how many people get vaccinated? How long does their immunity last? Data indicates at least 6 months, but we've only been immunizing since December. So we're going to have to see on that. Some data suggests that people who are immunized are less likely to spread infection and maybe less likely to efficiently spread it, but we don't have the full information there yet. And that's why even when people have been immunized, by wearing a mask, you decrease the risk that you might be carrying it without getting sick and spreading it to someone else. Also, Pfizer is 95% effective in preventing infection. 5% of people who are fully immunized can still get infection. Well, masks are good for that. Social distancing, the more immunized people around, the better, because the less chance that there will be a breakthrough infection. And then the issue of variants. The variant from England seems to respond well to the antibodies produced by Pfizer, and pretty well the South African variant, but we're not quite as sure about that one. And if other variants develop that evade the vaccine-associated immunity, then getting herd immunity will take longer. Next slide. This just shows that geographically throughout the United States, there are different strains that are circulating. On the right talks about the lineage, and the blue up on top were the early viruses that were circulating. And the tan is actually the variant from the United Kingdom, the B117, and it's predominating, although there are, depending on where you are in the country, it depends on where these, what they call variants of concern and variants of interest. The ones of concern are, can they spread more rapidly? Can they cause more severe disease? The one from South Africa is that deep, the dark orange, the B135, and you can see there's slivers of that in different parts of the country. And we'll just have to see how the spread of variants develop over time. Next slide. For those who want to get Pfizer vaccine, state sites only have Pfizer. And so you can sign up on that podvaccine.azdhs.gov, or there's, our website also has a telephone number that's listed below as to where you can call if people don't have internet access. There are 4 sites in the Phoenix area. Then there's one down in Tucson, one in Yuma, one up in Flagstaff. But again, Pfizer has come in this 1,170 dose trays. And so a lot of the clinics have wanted to go with Moderna or J&J because they're smaller minimum doses. Pfizer is going to be coming soon with a minimum dose of 450, but even that can be a bit large for some practices. Next slide. You've seen this. The vaccine finder has shifted over to vaccines.gov. You'll still be able to put in vaccine finder and get the vaccines.gov. And then county health departments on their websites, many of them identify where they have clinics that they're aware of. They give Pfizer vaccines. Some pharmacies do, some clinics. And so looking at the Arizona Department of Health website, they have a large map that shows different locations and what vaccines they offer. Next slide. Okay, there's a new pediatric COVID vaccine toolkit put out by the CDC, just brand new. So you can, put that in and search for it on the CDC website. And then again, those interim clinical considerations. When I get COVID vaccine questions, 95% of the time I find I'm going to that document to give me the authoritative answers on what to do. And finally, next slide. Disease is bad, vaccines are good. Okay, it looks like there's a bunch of questions.
Dr. Lewis, I have a few specific ones to read to you if you have time to answer them.
Absolutely.
We have some patients from Mexico. They got their first COVID vaccine from a different brand. Can we give a Moderna second dose, or do they have to repeat first dose again?
If they received, in the clinical consideration document, it says that if they received a brand that is not FDA approved in the United States, you do not consider that dose, and you just go ahead and give them either 2 doses of the mRNA vaccine or 1 dose of the Johnson & Johnson.
Okay, thank you. Diana, hopefully that answered your question. Here's another one. I'm having parents ask if the vaccine is only good for 6 to 9 months and will they need to have another next season like the influenza? You kind of addressed that, but what would be a good way to answer that when they're talking to a parent?
We know that it's the early information we have is that it seems effective at least 6 months, possibly longer, but you know, we don't have our crystal balls. So you just barely started giving vaccine in December. And now we are in May. And you know, hardly 6 months. Plus there are the variants. And so I've seen articles that come across, they're doing clinical trials on looking at how it responds to booster doses of just Pfizer and the Modernas. I saw one study where they actually have changed their vaccine a little bit and are giving a booster dose that's more specifically towards the South African B1.135 variant. You know, they get good antibodies. The question is going to be, are we going to need something every 6 months? Are we going to need something every year? If you, just as a general principle, if you're giving a vaccine frequently while you still have immunity, you're going to get more local reactions and more fever and more feeling poorly, more systemic reactions. So you want to, we very well may have yearly COVID vaccines along with yearly influenza. But right now we don't know for sure.
Okay, thank you. One other question, I'm not sure if you would know, if a parent guardian can't bring the child and sign the form, can the accompanying adult provide a letter from the parent or guardian? I think you might have to contact the office or pod or wherever you're taking that child for their vaccine, right?
I agree. And at the state location, the state pods that have the parent or legal guardian has to be present.
Okay, thank you so much. That's all the questions I saw for you. If anyone else has any questions, feel free to put them in the chat.
And you can also come off mute and just throw them in there. But Dr. Lewis, I was kind of wondering, you know, given that the top concern that patients have are the side effects, you know, how do you answer that for patients typically? What's a good way to overcome that concern?
Most of the time, the side effects are very mild, as you saw just from those graphs, that it's usually pain. And sometimes you can get fever and feel tired or headache. So those are the immediate side effects we're talking about. I think that parents also worry about long-term side effects. And most of the time, vaccines do not cause long-term side effects, but we're not able to say no because it hasn't been long-term. CDC is looking very carefully at any signs of serious problems, rare problems after vaccines. With the vaccine trials, they do 30,000 people. For Pfizer, for Moderna, they get 15,000 the vaccine and 15,000 not the vaccine, the placebo, and then you can compare. But that's not going to get you a 1 in a million side effect. And it was doing turning in VAERS reports if there's a significant adverse illness after the vaccine, whether or not you're aware, whether you think it's connected, that helps in the surveillance, but that doesn't show a cause and effect relationship. But the vaccine safety data link is then used if there seems to be a signal in the VAERS, the vaccine data safety data link. is hooked into the electronic health records of about 3% of the health maintenance organizations in the United States, and they can analyze in real time what's statistically being associated with vaccines or not. With the Johnson & Johnson vaccine, that's how they picked out the kind of the 1 out of a million reports of that unusual blood clot formation up around the brain. And it seems to be more in women under 50 years old. So it's just, in general, it's about 1 out of a million. In women, younger women, it's about 7 out of a million. So again, still very rare, but CDC will keep on looking for even rare side effects that could be happening after vaccine. And then nothing is risk-free. You just have to remember that we had 127 teenagers die from COVID. So you can say, oh, I don't want to have side effects from the vaccine, but then you could be the family that loses your teenager to COVID. So you have to balance the risk and benefits. And right now, the benefits from vaccines far outweigh the known risks and the theoretical risks.
Yeah, and I think I found it interesting that, I mean, I think it's great that we can now administer the vaccines at the same time, but my 12-year-old just got his 11 to 12-year-old shots because he's been home all year, so we were a little behind. But he was down for 2 days. I mean, both arms hurt. He was, complaining and tired and, oh, this is terrible. And didn't have a reaction at all to the COVID vaccine, 3 weeks later, just not even, didn't even bat an eyelash.
Yeah, it's variable. I know people that really were under the weather with the COVID vaccine, and I just did fine. Most people, almost always, unless you're talking about anaphylaxis, almost always the side effects after COVID vaccines are self-limiting, and you just kind of feel like your immune system is revved up to try to fight off an infection.
Yeah, that's good. And then can you just clarify again, so if a patient received an AstraZeneca vaccine in Mexico a month ago, they can receive their Moderna doses here and both doses, is that correct?
They would need to have both doses, or they would need to have a dose of J&J.
Okay, great. Does anybody have any other questions? Oh, go ahead, I'm sorry.
Oh, I mean, if AstraZeneca gets approved for use in the US, that would change.
Okay, yeah, that's good to know, because I think they're going for full FDA approval rather than interim, as last I heard.
Yeah, and I just learned that there's a presidential proclamation that says you've got to be fully immunized before you come to the United States if you're not a citizen. So hopefully that issue will not be as much of a problem, but sometimes, yeah, we've gotten a few questions on it.
And then they're currently doing the clinical trials down to, I heard age 2, but I also heard age 6 months. Is it the 2 different vaccines doing the different ages, or is it one or the other?
I'm not sure. This morning, Dana told us that the Pfizer was down to 2 years of age and expecting Moderna adolescents maybe in a month or 2.
Okay. Does anyone else have any other questions for Dr. Lewis regarding adolescent vaccines or any of the clinical considerations? Feel free to jump off mute. I hope that's a really good sign that things are going smoothly and everyone is getting a vaccine, down to those 12-year-olds. All right, well, thank you, Dr. Lewis. I also wanted to let everybody know that Maggie's on in case we have any ASIIS questions. Feel free to chat those in or jump in with a question. But we're also going to launch another poll now. So given the current conditions, what do you think would convince more people to get vaccinated? You know, given everything that you guys are hearing, what would be the incentives to get people to move in to deciding to vaccinate? And I love the more incentives, like the $1 million weekly drawing that Ohio is doing. I'm not really sure that Arizona is, you know, going to jump in on that one, but it is a fun idea to watch. I'll give you guys a couple minutes. Okay, we can see the results. I think got about half answered, a little more. More proof of safety. So I guess that's not unusual, considering that that's one of the main concerns that people have. More education from trusted experts in the community, requirements for school, work and events. You know, these are the things that we know that work well for all vaccines. You know, it's not unusual. These are the same ways that we talk about flu vaccines every year, that we talk about childhood vaccines. And the next slide, you can kind of see that the most trusted place that parents feel that they are comfortable getting a vaccine for their adolescent is at their regular doctor's office. So you guys are the experts. You are the ones that your reassurance really makes a difference for all patients, but especially for parents as they're making those decisions to get the vaccine. Interesting, in the survey that the CDC did, they found that fathers were more willing than mothers to vaccinate their kids, which I thought was a little bit unusual. Older mothers are more willing than younger mothers to vaccinate their children. So, you know, it's just, you know, something to consider is that parents have questions and they're worried. They're just trying to protect their kids and make the right decision for them. So know that they've got questions, that as soon as they come into you, that they have concerns and they have questions. And the more that you can do to reassure them and make them feel comfortable with the decision that they're making, the more likely that they are to get the vaccine. So I think I saw a couple of questions for ASIIS. Laura, I don't know if you have been able to pull those out. Maggie, are you on and maybe could address a couple of those?
Yes, I'm reading through them now and I'm adding them to the chat. Do we have to report our wasted doses every 24 hours? Yes, you have to report them daily to ASIIS. You also want to email them to Arizona VFC, your wasted and expired forms, which we should have a link, but if we don't, I'll add it to the chat and just momentarily when I find that form. Let me see what other questions.
Maggie, I see one I can read out loud to you. When reporting wasted vaccines, the reason does not match the form for W5 waste code. Which reason do we use?
I can bring that to attention to the vaccine, VFC, Arizona VFC. I'm not sure. I know that that was in discussion regarding the W5 wasted code. Let me see if I can message someone real quick and then get back on the chat and answer that. If not, we will take down your email and email you the response.
Okay, thank you. And Roxanne
welcome.
did post the wasted dose report in the
Awesome.
chat, the link to that.
Thanks, Roxanne.
I'm not seeing any other
And
ASIS
then-
questions. Does anyone else have any they want to unmute for or type in the chat?
This is Jennifer. I was just going to throw in, Maggie, could you walk through the process of transferring doses? We have a few clinics who are running low and need to do some second doses. And we have a few others that have some extra vaccine that are willing to help with some transfers. But can you kind of walk through, what does that process look like? What do they need to do?
They would have to reach out to the Arizona VFC to get approved to do those transfers. So if they're not, it's very hard to explain it, but I can try my best. So you would go to transfers in your orders tab. You would choose the VFC pin that you're transferring to, and you would select the quantity. You would obviously contact the Arizona VFC, inform them of the transfer, and they would tell you yes or no if the transfer is approved.
And then they take care of that on the back end of ASIS, so that's all done there.
Yeah, they approve it. They also, when you do the transfer, the person that's receiving the transfer, the facility, they need to go into their inventory and receive the transfer. That's very important in order for it to decrement and get removed from the sending facility. So again, you go to orders and transfers tab on the left-hand side of ASIS, then you'll see the transfer option. And then you will obviously select the doses amount that you're transferring, the VFC pin that you're transferring, or the pin, the COVID pin that you're transferring to. And again, you reach out to the Arizona VFC and you inform them of the transfer and they will approve it. Once they approve it, then you can go into your orders, inbound orders, and receive it, the receiving facility. And let me see. Let me make sure. I think we might have Angela on the line. Angela, do you want to just piggyback off what I just explained or add
Sure.
on?
Sure, I can. Sorry. I have the giggles, sorry. So we sent out a Granicus, I believe, that wasn't specifically meant for transfers, but it actually does have some bullet points that may help somebody when transferring. So I was trying to find it. I think the Granicus was regarding ordering doses in ASIS now that the Pfizer, Moderna, and Johnson & Johnson doses are Johnson & Johnson doses are all available for order in ASIS. So it touches on that. That's the main topic of the Granicus, but it does talk about transfers because that Pfizer minimum order quantity right now is still 1,170. So I'll just kind of read the bullet points and then I'm going to see if I can find that Granicus and forward it to one of the TAPI team members so that way you can have it in writing. Both the sending and receiving providers need to mail their data logger reports to the Arizona VFC email address, which is arizonavfc@azdhs.gov. That's first step. Transfers must be approved in ASIS prior to moving the doses. And then it has a link to the enter transfer in ASIS job aid. And the information that you'll need in order to enter that transfer into ASIS is the organization and facility of the facility sending the doses, and then the organization and the facility who's receiving the doses. You'll need the quantity, you'll need the lot number. And then like Maggie said, when the doses arrive, it's important to mark the doses as received in ASIS and to not administer the doses before receiving them into the ASIS inventory. Only onboarded active COVID-19 ADHS vaccine providers may receive COVID-19 vaccines. So you want to make sure that the receiving provider is onboarded and if they're in the drop-down menu to transfer to, then that's a good sign that they're onboarded. You want to follow the USP transfer guidelines. So USP has a specific COVID-19 transport guideline that talks about how to pack the doses, keeping in mind once frozen doses have been thawed, they cannot go back into a freezer. And keeping in mind, you would need to let the new clinic receiving the doses know what type of storage unit the COVID-19 vaccines have been in. And the reason why that's important is because if you have Moderna doses, for example, in the refrigerator, Moderna doses are only good for up to 30 days in the refrigerator. So if I'm a provider and I have Moderna in my refrigerator and then I'm going to transfer it to someone else, I need to let the provider that I transfer it to know, one, that it's been refrigerated so they can't put it back in the freezer. They can only keep it in the fridge, and how many doses or how many days it's already been in the refrigerator. So if I've kept it in the refrigerator for 5 days and then I transfer it to Jennifer Tinney, then I need to let Jennifer Tinney know, okay, it's been in the fridge for 5 days. You need to keep it in the fridge and you only have 25 more days before it will expire. So that communication needs to happen. And then keeping in mind wherever the vaccines are, there should always be data loggers with them. So during that transport, you want data loggers. And then the last thing to keep in mind is that the ancillary kit and diluent must also be transferred with the doses. Providers can't order ancillary kits separately, so it's important to keep the original ancillary kits with the doses. I'll put myself on mute and I will try to find that document that was sent out.
Yeah, that's a good point. I didn't even think about that part. Then, let's see, I was thinking of something along with that. I don't remember. Oh, I know, there's another question in here until I think about it. For wasted doses, how do they account for those? How do they manage those in ASIIS, Maggie?
They would have to first get approved by the Arizona VFC that they're wasting them. Once that gets approved, then they can go into the reconciliation page and select the category and reason why they were wasted.
So they're not automatically taken out of ASIIS once that form has been approved? They've got to do that
that's just the
themselves.
physical form that gets sent to Arizona VFC. They still have to go into ASIIS and reconcile their inventory and indicate the reason, category and reason why it was wasted. Dropped, broken, spilled, whatever reason it is, they'll choose it on the drop down.
Okay. And
hi there, sorry. That's the question that I had, because on the wasted code W5, which is the open vial, all doses not administered, when I try to enter that, when I try to enter the reason why, the option doesn't pop up. Like it
The
doesn't
wasted
match.
5?
Yeah.
Yes, so I know I had seen people using wasted 2 for W2, but I want to verify that with the Arizona VFC. I know that they were saying match it as closely to as possible, and I know that they were saying okay to W2, but like I said, I want to verify that with them before I say select W2.
Got it, thank you.
But yes, please put your email in the chat and we'll get an answer for you.
And Maggie, once they put an order into ASIIS, how long does it take to get there? So if they ordered today, where are they in the cycle for shipment?
Angela, I know that you're more familiar with seeing the time frame turnaround for the vaccines being sent out to them.
So you're asking once they place an order, how long it takes to get them?
Yeah.
So it depends. So I would plan for at least a week and then be pleasantly surprised if they come sooner. Our CDC allocates to us twice a week, so we're going in there and approving them twice a week. So it kind of depends, if you were to submit an order. I know we've had people submit an order right after we just did the batch of approvals, and so then their order is going to sit until the next batch of approvals. So I would plan for around a week, and then if you happen to submit your order right before the batch approvals go through, then it's only going to be a couple days. But if you happen to submit your order right after we do approvals, then it's going to be a little bit longer. So I would plan for 5 business days or a week if you don't want to think in terms of business days, just to be on the safe side.
Okay, that'll help. Thank you very much. Okay, I think we'll jump back into the slides, but if you guys still have questions, put them in the chat and then we'll field them to everybody and try to get them posted as quickly as we can. We have some resources and materials to kind of help you have that conversation with patients and especially now with parents as they're considering vaccinating kids. We have a slide set that has some of the common questions that come up with some bullet point answers that you can provide as you're having those conversations. Another tool that we have available is vaccinating kids with sensory disorders. I know that's going to be tough, and especially in those mass clinics when you're kind of moving people through. So we've got some tips and tricks for how to make that happen. There are also therapeutic holds for older kids, you know, because even my 12-year-old was very nervous, especially after getting his 3 adolescent vaccines 3 weeks ago and then getting his COVID one. He was a little nervous the other day. So he did sit on my lap, even though he's bigger than I am at this point. Next slide. We have some tools for outreach for adolescents, sticky notes that go right on the vaccine card, especially if you're doing walk-in clinics. It sticks right on there and it reminds them that your doctor may want to see you for well visits or other vaccines. So if you're doing walk-in clinics, you might want to order some of those sticky notes to add to it just to remind them that they do need other services as well. We've got a flyer to do some outreach for the 12 plus, and then just think about those other teen vaccines that they may have fallen behind on, because again, my 12 would have gotten his doses about a year ago and didn't because his office was closed. So be sure to check those 12-year-olds, the 16-year-olds for those additional meningococcal doses. And then next slide. I think the important thing here, we're kind of changing the schedule of the COVID tips a little bit coming up for the summer. So next week, we will be here at the regular time for the Thursday training for next week. We're going to try to have a practice come in who's talking about bringing in adults and teenage patients at the same time. We're doing the parents while they do the kids if they're a pediatric practice, or if you're an adult practice, maybe doing some of the kids that are coming in with your patients. So that'll be next week at the usual time. The following week, we won't be doing a COVID specific training, but we do have the 10 things parents need to know about why we immunize. That will be happening, and that kind of walks you through those common questions that parents have about vaccines, some of the basic information that we want them to know and to understand as they're making a decision to vaccinate their kids. That pertains to all vaccines, not just COVID, but COVID is included in that. Then beginning on June 10th, we're going to move into the summer tips programs. We do these kind of tip style programs for all vaccines in an office. So we'll be hosting those every other Thursday during the summer. And so we'll be talking about storage and handling, vaccine administration, and all of the things that go into carrying vaccines in a practice office. So it will change our schedule just a little bit. We'll see you next week for this regular time, the following week for how to talk to patients about vaccines, and then June 10th, beginning our every other session on having vaccines in your office and carrying them in your office. So I think that's it for us. You know, feel free to add some questions to the chat, and we'll be happy to hang on for a few minutes to answer those. Be sure to do the evaluation and let us know if there are other topics that you do want to talk about in the upcoming trainings. And then we will certainly be sure to see you next week. You can jump in with questions too. You can go off mute or stick them in the chat. Laura, did you see if we missed any questions that kind of came in that ending part?
I don't think we missed any. I think we got them all. If you did not get your question answered, please repeat it in the chat. That would be helpful.
So I just had a question about the dose for dose replacement for the requirement. No, not at this time. The CDC has said with COVID vaccine, this is a different system than a VSC. And in fact, COVID vaccine can't even be privately purchased. So you can't replace those doses. And it's not an expectation that you will. You know, who knows if that's going to change in the future as we begin to do COVID doses every year with the flu. It might, but for right now, give a vaccine to anyone who comes in so you don't miss that opportunity. Even if you have to waste those other doses, they will not be counted against. You won't be counted for those. You won't have to replace them, and it will not interfere. I don't believe it's going to interfere with your VFC status. Angela, if you're still on, have you heard anything more definitive about that?
I haven't heard anything more. I mean, just try to plan ahead as best you can, but if you need to use 2 doses out of a 14 dose vial, then use the 2 doses.
Yeah, so, and it shouldn't count against your 5% of VSC because it is a different funding program. We don't think it's going to, and given how much the CDC is saying, please don't miss an opportunity, I don't think they're going to hold that against you. Anybody else have any questions? Just out of curiosity for anybody who's still on, are you all finding it easy to talk about adolescent vaccines? And do you have a lot of parents who are really anxious to get them? I had a hard time finding one for my 12-year-old, so I think I'm not in the Valley, so it was a little bit harder. Yeah, parents of both high schoolers especially have been anxious to get them. I'm sure, yeah, those high school students are really chomping at the bit to get out and go do stuff. So it's probably, they've been waiting, ticking down the minutes. And the really good thing, and I think that's going to be an incentive, is right now, if kids are exposed, they have to be excluded for 2 weeks for activities in schools and things like that. If you have a vaccinated child that has been exposed in a classroom or through sports or summer camps, they don't have to be excluded. And I think that'll be a huge one for parents who have spent the last year at home with their kids to be able to send them somewhere and not have them bounce back and forth. Okay, I'll give everybody another minute to submit some questions if you have them, and then if not, we'll go ahead and close out.
Sorry, hello, this is Yolanda from SIPMD. I have a quick question. I was just recently put to taking care of the stuff here with our vaccinations. Is there, can you send me a link through email of where I would be able to get on through ASIIS to be able to complete the end of the day report? And if there's anything else that I need to complete in regards to ASIIS. Basically for reporting.
For report, have you reported any doses to ASIIS yet?
Not that I'm aware of.
Yeah, we have a how to get started guide that has the links for everywhere that you report or questions that come up. We'll post that on the recording for today, and then get that out to you. Maggie, do you guys have any kind of how to get started stuff from ASIIS, or where she should begin day one?
Does she have access already to ASIIS? Yolanda?
I believe we do have access to it. We do have a sign in and everything to be able to get into ASIIS.
Okay, so you're just wanting to start off to
Yeah,
start
I'm just
reporting.
wanting to start off, ensure that everything is done correctly and is completed. Since this task was handed over to me, I just want to make sure that I'm caught up
I
and I
would
know what I'm doing.
recommend reaching out to your IPS for your location so they can actually guide you through each step that is required from our department. They would go through a training with you and train you what is needed from your end and from us as well. If you want to go ahead and put your, are you a VFC provider, a COVID provider? Do you have a PIN?
I believe we are, yes.
If you want to go ahead and add the PIN in the chat, I can reach out to your IPS and have them reach out to you directly.
Okay. Thank you.
Maggie,
welcome.
what's an IPS? I don't know that I've known that. I've heard that one.
So the definition of an IPS, Angela, do you want to give the definition to the IPS?
Sure, it's Immunization Program Specialist.
And exactly, I don't exactly know exactly their job title, what they do, but I know that they onboard and help providers, find all these trainings. They help them with their on-site visits. They all the requirements that we require in our department. So they're a very helpful resource to have. They're kind of like your go-to to answer questions if you're having inventory issues or any type of questions. They're very knowledgeable, and they're assigned directly to your own. They're assigned to your PIN.
Oh, okay, perfect. So your IPS could be your first stop for some of the questions that have come up?
Yes, they're very knowledgeable. I can say that team is very knowledgeable in like the reports, the patient detail reports, the usage and recall reports. They work on those reports nonstop.
Okay, great.
In case it's helpful, like in other states, the IPS I think are referred to as the site visit reviewers or field staff. Sometimes other states will call them that, but they do the compliance visits for VFC. They do the compliance visits for COVID-19, and then they are assigned territories, like Maggie said. So that's good. And they can point you to, there's IPO training lessons that might be helpful to you, Yolanda, as well, and other things, so they can kind of figure out where you're at in the process and then guide you to the next step.
That's great. Any other questions? Okay, well, if that's it for this week, then I think we'll go ahead and shut down for today, and then we'll plan on seeing you next week. Feel free to submit questions to us in between on the survey, or just email any of us, reach out to us, and we'll be happy to try to get those questions answered for you midweek. Thank you. Have a good day.